The following portion of Good Day PA is sponsored by WellSpan Health. Over the holiday season, illness tends to peak, and with busy schedules, figuring out how to get appropriate and convenient care can be time-consuming. Well, WellSpan Health offers convenient options like virtual visits and urgent care, which can be especially beneficial for older adults. Here to share how WellSpan is helping patients avoid long wait times and get care quickly is Dr. David Gasperack. So how can someone determine the right place to get care if they have symptoms or a condition that they feel like they're experiencing?
So what I always tell my patients is ask yourself, do I need care soon? Do I need care quickly, or do I need care now? Right, so obviously if you need care now, it's a life-threatening condition, you should really be in the emergency room. But for everything else, we recommend starting with your primary care provider. And if you don't have one, you can go to wellspan.org/getcarenow to look at some of the options we're going to talk about today.
Okay, let's go through some of those options. When do I need care? The answer is soon.
Right. So soon is really any time from now up till 2 weeks from now, right? And like I said, starting with your PCP is your best bet. If you don't have a PCP, if you take anything from today, please go online and get established with a primary care physician. They're the ones that they know you, they know your medical history, they can help navigate through what is a complex health system. So starting there first. If you don't have a primary care provider, you can go on wellspan.org/primary care. And you can see all of the providers and offices that are within South Central Pennsylvania. We've recognized that task can be a little overwhelming to pick a primary care provider, so we've established what are called nurse navigators. So you can schedule an appointment with a nurse navigator, meet with them virtually, and they can walk through the options in your geography, the ones that take your insurance, the ones that are accepting new patients, and find that match that's a good fit for you. And then they can schedule either an in-person visit or a virtual visit, whatever seems to work for your schedule. We also offer what's called virtual on-demand care, and it's access to a licensed provider 24/7. So we also know that when you're not feeling well, it's not always fun to get dressed, get out of the house, get to the doctor's office.
Yeah.
Nor is it a great idea to spread those germs around. So you can access virtual on-demand care from the convenience of your home 24/7.
What if you feel like you need care quicker?
Right.
Like you can't wait that long?
Right, so if your PCP can't accommodate, the next best option would be urgent care. So WellSpan has 15 urgent care locations and 5 urgent ortho locations across South Central Pennsylvania. That's really good for acute illnesses, minor injuries, things that might require in-office testing, maybe an x-ray, but it's really that treat and street mentality.
Okay, but what if it's right now? Like I need to see somebody immediately.
Right, so obviously our emergency rooms exist for a reason, right? So it's those life-threatening symptoms, so chest pain, shortness of breath, symptoms of a stroke, severe allergic reactions, major trauma. That's when you want to be in the emergency room, in the hands of a provider who has the resources to diagnose you, treat you, maybe even admit you for a couple days if that's what's needed.
Okay. Final question. How can we find a WellSpan location or just learn about these different virtual care options?
Right, so the good thing is it's all spelled out on the website, www.wellspan.org/getcarenow. Walks through all the options we talked about today. Again, if you take away one thing from today, it's get established with a PCP. They're the ones that are going to help you navigate through all of this.
Sure. Thank you.
Thank you.
Good to have you with us.
Pleasure.
The previous portion of Good Day PA was sponsored by WellSpan Health.